A patient today asked about exposure therapy, which is a type of therapy that belongs to CBT or cognitive behavioral therapy. Specifically, they wanted to try to figure out a structured way that they could work on exposures at home to slowly become less anxious or to slowly have less of a physiological or anxiety response to their fear of heights. Obviously, there are a lot of different ways that you can manage this. But one of the approaches that we talked about was actually making a hierarchy of situations that would potentially make the person anxious with regards to their fear of height, that they could slowly work up. So a ladder, this is called a hierarchy ladder, and it can be used in CBT for the treatment of someone's anxiety without medication. And so what we did was we went through different situations. I asked the person to brainstorm lots of situations where they would feel anxious because of their fear of height. So they talked about taking an airplane ride. They mentioned being in a hot air balloon. They mentioned that there was actually a hot air balloon that had a limit of like 20 or 30 feet at the Philadelphia Zoo. They talked about looking over a balcony at a friend's home. They talked about taking an escalator at the local mall. They mentioned being in an elevator in a high rise recently that was really made them very weak at the knees. And they even talked about how when they go to a subway station and they look down, just the drop from the platform to the tracks of maybe 6 or 7 feet, that invoked an anxious physiological response. And it caused them significant distress and at times even avoidance of taking the subway, etc. And so what I had them do is to, next to each of those different scenarios that would typically cause them to have increased anxiety, to write a number from 0 being 0 anticipated anxiety, or 100, the most amount of anxiety that they could imagine having because of a stimulus, and rating each of those different things from 0 to 100. We then took each of those additional items and we put them in order from the least anxiety provoking situation to the most. So for example, that situation that I gave of them standing on the platform by a subway and looking down, obviously being careful to not stand past that yellow line to be at risk of falling, but looking over and looking down at the tracks about 6 or 7 feet below, that invoked a fear response of maybe 10 or 15 out of 100 for this individual. Going to the mall and taking an escalator 3 floors up, they thought that that would invoke about a 35 or a 40. Going to a high-rise building and taking an elevator to a 15th or 16th floor, that invoked, or they believe that would invoke about a 60 or 70 out of 100 in terms of their anxiety. And then the hot air balloon examples, the one at the zoo for about 20 feet, that invoked about a 70 or a 75, and just being in a hot air balloon or taking a flight, that was at your max of 100. So we devised a plan for them to actually start off with their least anxiety provoking situation, that 10 or 15 out of 100, going to the subway stop and looking down on from the platform down to the tracks in a safe way, to start off by doing that. And by doing it over and over and over, going several times a day, a couple of times a week to a subway stop and doing that. And that once they started to notice that their anxiety level was kind of increasing while they did that exposure, but after a while you do the same thing over and over and over again, and that actually will get a little bit boring. And when something becomes boring, it tends to be less anxiety provoking, and it tends to invoke less of an anxious or physiologically anxious sympathetic response. And so that idea, that concept in cognitive behavioral therapy is called habituation. You become habituated to that stimuli of making you anxious from that trigger. And so once the individual would be comfortable, or at least really not have too much anxiety going to that platform and looking down at the tracks, then they would move up to the next item, the next stressor on that event, on that ladder, that hierarchy of stressors, and start to go to the local mall and take the escalator up to the 3rd floor over and over and over and over again, a couple of times a week and a couple of times each day during those days that they went, until they started to get bored of doing so. And then after that, starting to actually going onto elevators and high rises and taking it up to the 14th or 15th or 16th floor over and over and over again. And so you can see as you work your way up this hierarchy, you're tackling more and more anxiety provoking and more difficult things. And you're continuing to habituate yourself to become habituated to having that anxious response to those stressors. And then suddenly, as you're as you're going on a hot air balloon, 10 or 20 feet up in the air at the Philadelphia Zoo, the idea of taking an escalator in the local mall or looking over a friend's balcony becomes no big deal. And this can be an incredibly effective way to treat someone's anxiety without the use of any medication. If you believe this video pertains to you in any way, please be sure to reach out to a mental health professional directly.